Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about in-house patient collections. This is going to be different than your, quote, hard collections, where you're sending patients directly to a collections agency. They assume the balance on a patient's account, a delinquent account that's not getting paid, and then they go after the patient trying to get it paid. And if any money is collected, you get a certain percentage to you, and then they keep a certain percentage as their payment for tracking down the patient and getting them to pay. This part that I want to talk about today is what would be more considered like a soft collections. It's an in-house process that you would establish for collecting delinquent patient balances to a certain degree before you send them to the hard collections. We all know that there were some changes in legislation a few years ago that medical collections can't ding a patient's credit report, but that's not fully true. It depends on the type of medical debt, the amount of medical debt. I don't know all the details, but I do know that it's still, if you send a patient to collections, there is a possibility it could still hurt their credit. And nobody likes to send their patients to collections, especially when you have developed a rapport and a relationship with patients. Depending on the specialty you're in, you're going to be more likely to have that connection with patients than others. But I encourage everyone to have an internal soft patient collections process before sending patients to hard collections, because sending patients to hard collections is just money you don't get because they take the percentage. It makes you, quote, look bad to patients, which that's their own problem. They put themselves in that situation. But you know what I mean? It's that whole look of customer service and stuff like that. And it's just tracking wise, it can be a nightmare sometimes. So if you can establish a very efficient in-house patient collection process prior to sending patients to hard collections, I think you would be sitting a lot better. And now with technology and all the tools that are out there, it almost makes sense to do it this way, because then you don't have to pay a percentage to a collection agency. You can try to keep all that money in-house. So I usually try to start the soft collections process about 90 to 100 days after a patient's bill is past due and they've received at least 3 statements stating they have a past due balance. And I try to make my statements look very clear that we offer payment plans if you want to offer payment plans, but I always made it very clear we offered short-term, no interest payment plans. But I also made it very clear that the patient would have to contact us to initiate that. We weren't going to call patients to initiate it unless it's maybe someone that we know, or they're elderly or something, and maybe they have a little bit of trouble of doing it for themselves. You get to know kind of your patient population and your patients in general. And we would say, you need to pay by this time, this time, this time. There are a lot of laws around patient collections in general. You would be surprised, but it's true. If you work with a hard collections company, they will inform you and update you on everything that's required in order to send a patient to collections, words you can and cannot use in different phases of the collections process. So one thing to be aware of is if you're doing a soft in-house collections process, you can call it that internally, but you don't ever want to use the word collections to a patient until you actually have sent them to hard collections, which is the collections agency. You cannot use that word as like a threat. You can't use it as something that you're throwing out there that they pick up on and go, ooh, they said collections, it's a naughty word. You can't do that. But you can insinuate it in nice ways, professional ways. You can say, if you don't pay by this date, then we will need to move your account to the next step in this process, or we will move forward in this process of obtaining your balance. Something like that. You can get creative, but you cannot use the word collections. So just make a note of that. Just know that when you're setting up this process. So anyway, I go back to 90 to 120 days. It's delinquent. There's still a balance, or they're accruing more. That's the worst part, right? Where they have a balance and they keep coming in and they're accruing more and more and more. So then I would find out how my system can generate a report for me to identify those patients. And then I would establish designated people in my practice, whether it's the front office or you have some billing people or whatnot, that certain days of the week or certain weeks of the month, however busy you are, the volume, the more you have, the more often you should do it. They should start working on these patient accounts. Now, you can decide how you want to do it. And depending on what resources you have available, whether you have patient portals, text messages, if you want to do phone calls, if you want to do old school letters, however it is, you can decide how you want to do it. And I usually did it for like another month, month and a half. And if I didn't get a response after 3 attempts during that time frame, then we would send a patient to hard collections. If we had no response, it's like we tried, we sent them to hard collections. But I at least tried to give 3 attempts in addition to those statements still going out, those normal, regimented, scheduled statements that are being sent to the patient. I would make some additional attempts in between, whether it's phone calls, sending a letter, a text message that's more personalized than maybe what they have been receiving, portal messages, however you communicate with your patients and how they tend to respond. My last attempt, which would be the 3rd attempt, I would definitely be sending either a portal message that's documented already in the patient's account or a paper templated letter that I've created. And I would say, this is your last chance. We've tried contacting you for this many days, this many months. We've had no response. Please respond within 15 business days of this letter date, or however you want to put it. And I would make sure that I scanned that in, because the collections agency would want to see that as kind of evidence, if you will, to put in the patient's chart on their side if you did have to move forward with sending them to collections. But it's just always good to document anything you do in a patient's account. It doesn't matter if they call for a refill, if they call and have a question, if they call about their balances, they call about medical stuff. Everything, anytime you talk to a patient about anything, it should be documented, including financial stuff. And so anytime somebody is making a phone call to them, they should document the time, the date, and if they left a voicemail, that's all it has to be, but at least it's documented, right? If you're using electronic means through your EMR system or something that will, interface to your EMR for documentation, that's even better. Text messages, portal messages, any kind of way of communicating that is offered. If it's documented in the chart already, that's great. But if it's not, then you need to make sure your staff is aware that is a requirement and they would want to record it, okay? They need to record what number they called. If you're sending a letter, like I said, you want to make a copy of the letter and scan it in, like I said, so you can see that what the address is, because you should have it business format, formal letter. So it should have the address where you're sending it, the name of the person, all of that. There's a bunch of templates online. If you're not sure, I'm sure you can even go to ChatGPT and you can ask it to draft up a formal business letter template for asking patients to pay their bills. If you ask for a collections letter, it'd probably give you like that hard collections letter that the collections agency uses. So you might not want to do that because you might have to reword stuff, but you can ask it to do that. I mean, there's so many tools at our fingertips anymore with technology that you need to utilize them. But you need to have certain people responsible for the process. You need to be checking in with them as the owner or the manager, whoever set up this process, to make sure they're doing it as expected. They're doing it as frequently as is expected, and you're checking to make sure that the notes are in there when they need to be, and then whose responsibility it would be to finally say, okay, it's done. Like, do they give you a list that says, these are the people we've tried contacting this many times and they haven't responded, and you go, yep, we need to send them to hard collections. Like, there should be like a double checking system, so you don't just have rogue employees sending people to collections and you have somebody who's aware of how much money is not getting collected, because that affects like budgeting and finances and forecasting. So you need somebody who's higher up in the chain of the clinic to make sure that they're overseeing this process and giving the final approval of when patients need to be sent to collections. In a lot of the practices that I worked, the doctors wanted to see the list of patients who need to be sent to hard collections because they know the patients a little bit better. And there were times where they were like, ooh, I understand their personal financial situation right now. Let's hold off. And sometimes they'd be like, oh yeah, no, that we've given them enough tries. This is a constant battle every time they have a balance on their account, and then you can send them. The one last point I want to bring up about this is what is going to be your internal policy if you do send someone to hard collections? Are you going to allow them to continue being a patient there and expect them to pay sooner and have some kind of arrangement, maybe where they agree to put a credit card on file so you can bill it immediately upon them having some kind of balance on their account? Because if you try to pre-collect their visits, sometimes insurances on your contracts don't like that. Other times you might be forecasting or predicting that they'll owe too much and they overpay and then you owe them a refund. It can be a nightmare. So the other solution to that is asking them if you can have a credit card on file that you can just charge when there's a balance. Of course, there would be certain criteria to that, like if it gets canceled or no funds, it gets rejected, denied, that you contact the patient, they have to pay within 24 hours, or you're going to send them to, I don't know, you have to come up with your own financial situation, but that's why I'm bringing it up to you so you can talk about it. But I've been in practices where if they send a patient to collections, they're no longer able to be a patient anymore. So they receive a discharge letter. They say, we'll offer you 30 days of emergency health care until you can get established elsewhere. But we have sent you to collections, and our policy and our financial agreement that you signed says that if we send you to collections, you can no longer be our patient. I mean, there's certain things like that. You do have to be aware, however, you cannot withhold services from patients because they owe you money. You cannot not refill a prescription. You cannot see the patient. You cannot delay their care. You can't do that. It's against the law. And I don't know the law exactly, but I just know that you can't do that. So I can't quote you exactly why you can't. I just know you can't. If you disagree with me or you've heard differently, I would encourage you to look into it, speak with a healthcare attorney, a collections attorney, just to make sure that if you put any of those policies into place that you're not breaking any laws or rules or anything like that. So, all right, if you have any questions or comments about establishing an internal patient collections process, please leave that in the comments below. I would love to help give you some ideas or guide you. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues. Have a wonderful day. We'll talk to you next time. Bye-bye.